Welcome to the Chapter 8 video for our human biology course. In this chapter, we're going to focus on cancer. We're going to talk about what cancer is, how exactly it happens, and what exactly it kind of does to the body. We're going to start off with just a general introduction to cancer. And then we'll kind of move into looking at different stages, and then we'll finish up with talking about some of the kind of deadliest cancers, and then some other cancers that you should probably be aware of and be familiar with. Now, if you remember in the mitosis and meiosis lecture, we talked about the cell cycle. And the cell cycle, remember, is regulated by this check system where it looks at the cell after the G1 phase, after the G2 phase, and after the division phase to determine whether or not the cell is functioning properly, has underwent division appropriately, there's no errors, and it can go on and kind of continue the cell division or cell replication process. Now, cancer is kind of it comes from the cell cycle not functioning properly. And so cancers are basically diseases of the cell division process and cell differentiation process. Okay. There are many different types of cancers that exist. So there's, over 100 probably different types of cancers. And some of the key characteristics of normal cells, again, is that they have this these regulatory mechanisms that maintain that appropriate rate of cell division. So they have this internal clock, right, that's regulating that, along with those checks, right, that happens in the cell division process. Now, where cancer happens in the body is that the cells will deviate from this appropriate rate of cell division, and we'll talk about what exactly happens when that deviation happens. Regular cells, normal cells, also generate hormones. They have inhibitory signals that come from nearby cells, so they're communicating with nearby cells, and they remain in one location throughout their lifespan. Right? So these are big key characteristics of normal non-cancerous cells. Okay, with cancer, it begins with a cell that has been, say, genetically altered, and that alteration or that mutation of the genetics in that cell allows the cell division process to happen at an increased rate. And so when that cell undergoes a substantial increase in the rate of cell division, this is known as hyperplasia. Okay, so you start to get this cell to divide, and because there's this genetic alteration in that cell and it's dividing, the daughter cells have that genetic alteration as well. So now the two daughter cells will divide relatively quickly, and then they'll produce daughter cells with the genetic alteration. And so you'll get a lot of cells with this genetic alteration that will divide relatively quickly, and it will develop into a tumor. So these tumors are also known as neoplasms, and it's a mass of cells that come from a hyperplasia. So it comes from that increased rate of cell division. Now we can have benign tumors that are non-cancerous. So these are cells that are remaining in one location. They're in a well-defined mass. So those cells that are replicating at a high rate are kind of clumped all together in a pretty well-defined mass, and they could also be surrounded by connective tissue. So that's not always the case, but can be surrounded by that tissue. And the benign tumors, because they are in a well-defined mass, can pretty often be removed surgically. And so doctors could just go in and remove that tumor, um, and check to see if it was cancerous or not. And so the characteristics of a benign tumor are, these types of characteristics here. So well-defined mass remaining in one location, surrounded by connective tissue, and again, generally in one place. And so here we have kind of a figure of this where you have this genetically altered epithelial cell, so skin cell, and that mutation causes a rapid cell division rate. And so you get a lot of those cells very quickly. So you start getting a mass of those cells, and then eventually that can become a tumor, right? And as long as it's kind of following those key characteristics that we just mentioned, it could be a benign tumor, right? Um, Cancerous cells that aren't benign will undergo this abnormal change in cell structure. And so they deviate from those typical characteristics of normal non-cancerous cells. And so dysplasia is known as a precancerous state. So this is where we're beginning to see these abnormal changes. And we define a tumor as a cancerous tumor when it loses organization, it loses structure and regulatory control of the cell division process. Now, an in situ cancer is a tumor that stays in place. A malignant tumor is one that invades normal tissue and compromises the function of the organ or tissue layer that it's associated with. Okay. Now, these malignant tumors can also undergo what's known as metastasis. They can metastasize. When a tumor metastasizes, the cells of the cancerous tumor, the malignant tumor, will spread to another region of the body or to another organ of the body. They can develop secondary malignant tumors at other locations, and then those tumors can metastasize and spread depending on the severity of the cancer. And so there's different stages at which these cells can exist. Okay, so for cancerous cells, right, you have that genetically altered cell. It divides more rapidly than normal, so that's the hyperplasia. Then if those cells begin to change form, change shape, and change structure, then we know that they're these precancerous cells. That's known as dysplasia. And then as long as those cells stay in one place and they don't move to other areas of the body, it's known as an in situ cancer. Man, I can't talk. Malignant tumors are cells that are invading surrounding tissues, right? So you see this invasion area here. Now, they metastasize when they go to different sites. So these cells can invade the bloodstream and move with the bloodstream and invade another organ. Okay. And so it's important to kind of understand those definitions, because by understanding those definitions, we can say, okay, it's an in situ cancer, and you know exactly what type of tumor you're dealing with. Or if it's a malignant tumor, you know that it's starting to invade adjacent tissue, or if it's metastasized and that cancer has begun to move and spread throughout the body. So here is a table with the types of tumors you can have. So benign, in situ, and malignant, the frequency of the cell division, the cell structure and function, and then the tumor organization of those different types of tumors. Now, cancer can be classified as different, or as being in different stages. And a lot of times you'll hear somebody say, you know, my family member or I know someone who has had or has stage 1 lung cancer, or stage 2 or stage 3 liver cancer. Right? And so those stages are basically defining where the cancer is in terms of this process, right? So what type of tumor they actually have. Now, it depends on the type of cancer for what exactly that stage is, but generally, stage 0 is an in situ cancer. Okay, the cells are abnormal, but they're only in one location. Stage 1, 2 through 3 is defined again by the specific type of cancer, but it's based on the size of the tumor and then the degree of spread from that tumor, and whether or not it's malignant or if it's starting to invade adjacent tissues, etc. Stage 4 basically means the cancer has metastasized and it's starting to move or has moved to other sites in the body. Okay, so stage 0 and 4 is pretty general. So in situ versus metastasized tumors. Whereas stage 1 through 3, the definition and the degree of kind of where that tumor is in terms of going from in situ to being metastasized depends on the type of cancer. Now, in order for cancer to form and develop, so in order for that tumor to begin to develop, two things have to happen at the same time. First is the cell has to divide uncontrollably. And second, the cell has to undergo physical changes and break away from the surrounding cells, and so basically become more different. And these changes usually correlate with certain mutations in the cell's genes. And if you look at those mutations, right, they usually are associated with a couple of things. We'll give some examples of those in a second. But before we do that, we want to kind of look at what's known as proto-oncogenes, oncogenes, and kind of what these mean. So proto-oncogenes are these normal regulatory genes, and they promote normal cell growth, appropriate differentiation, appropriate division rates, and adhesion to other cells. Now, oncogenes are proto-oncogenes that have mutated or become damaged, say to radiation or other environmental factors, and they cause or lead to the cells to grow and divide more quickly than normal, and they don't respond to those checks that exist in the cell cycle. And generally, your cancer will develop when you have multiple oncogenes present. So multiple proto-oncogenes that have become mutated, right? And they begin to allow those cells to grow and divide more quickly because they're not regulating or promoting that normal cell growth or division patterns. Now, some tumor suppression genes are these regulatory genes that will repress cell growth, division, differentiation. These tumor suppression genes can be turned off or become mutated or damaged, and we generally see that in cancers. So for example, if you have the P53 tumor suppression gene that is mutated, you're at a pretty high risk or a higher risk that cancers can and will develop in your body. And researchers have seen the P53 tumor suppression gene having mutations when they look at specific cancers like cervical cancer, colon cancer, bladder cancer, breast cancer, lung cancer, etc. So the mutations in proto-oncogenes, mutations in tumor suppression genes, causing those genes not to function appropriately, lead to the development of cancerous cells. Now, there are also mutator genes which are involved in DNA repair during that replication process. If those mutator genes if they have mutations themselves, then they're not going to function properly. So these are those proofreading genes, right, that proofread the DNA after they've been replicated. Now, if those proofreading genes aren't working because of mutations, then they're not going to find those mutations or those errors in replication, and they'll make it through existing in those cells, potentially causing uncontrolled cell division and leading to the growth of cancer. So here we have a figure kind of showing these relationships. You can get mutations in proto-oncogenes, which will lead to, where's it at? Abnormal cell growth. So you get those oncogenes and you end up with cancerous cells. And then you can also get mutations in your tumor suppression genes that will lead to the development of cancer cells as well. Okay, so it could be a combination of any of these. But the key factor here, like we mentioned, is that these mutations in these genes are allowing the cells to divide uncontrollably and to undergo physical changes that causes them to have abnormal structures and functions compared to the normal cells in the tissue. So we have a little video that kind of summarizes a lot of this information, and we'll just check that out before we continue to move on.
Every cell contains DNA and genes that code for proteins that build cellular structures and regulate cellular activity. Under normal conditions, transcription of DNA produces the correct mRNA sequence. mRNA is translated into the appropriate amino acid sequence, which then folds into a functional protein. When there is a change in the cell's DNA, a mutation, the RNA and amino acid sequence change as well, and in many cases, a non-functional protein is produced. Proto-oncogenes and tumor suppressor genes encode proteins that control the cell cycle. Functional proteins will stimulate cells to divide only when conditions are right. They will suppress cell division when conditions are not right. If mutations occur in these genes, then non-functional proteins are produced. Oncogenes, which are mutated proto-oncogenes, overstimulate cell division. Mutated tumor suppressor genes fail to stop tumor growth. Typically, proto-oncogenes and tumor suppressor genes must both be mutated to cause tumor formation. Eventually, these cells form a mass of excess cells termed a tumor. If the tumor is not invasive to neighboring cells, it's termed benign. If those cells become invasive to neighboring cells, the tumor is referred to as malignant and is cancerous. Malignant tumors have the potential for metastasis. Metastasis occurs when cells from the original tumor break off, allowing cells from the tumor to enter either lymphatic vessels or blood vessels. From there, the cells have access to the bloodstream. Those cells can then travel to new locations and establish secondary tumors. In addition to proto-oncogenes and anti-oncogenes, the body has many additional mechanisms to stop rampant cell division, including a DNA repair system, apoptosis or cell suicide, and a preset limitation to the number of times a cell can divide. With all these controls present to prevent uncontrolled cell division, how do tumors ever get a chance to form?
Okay, so looking at kind of cancer and some of the risk factors that lead to the formation of cancer, right? So how do these mutations happen? What causes these mutations to happen in the oncogenes and the tumor suppression genes, etc., right? So some of the biggest factors that lead to the development of cancer or having a higher risk of cancer are things like age, The longer we live, the more likely we are to generate those mutations and our bodies to develop the cancer, um, inheriting some genes that increase susceptibility to cancer. So it may like run in your genetics, on your family lineage. Having being exposed to carcinogens. So basically, carcinogenesis is where you transform a normal cell into a cancer cell. And this can be done by a carcinogen, which is any kind of substance or physical thing in the environment that leads to the development of cancer. Okay. Um, Viruses and bacteria can also cause cancer. So, for example, HPV could lead to cervical cancer. Hepatitis B and C could cause liver cancer. HIV can cause sarcoma. Um, Epstein-Barr can cause Hodgkin's. And then you can also have a human T cell leukemia virus. So bacteria and viruses can cause diseases that potentially lead to cancer or cause higher risk of getting a specific type of cancer. Other chemicals in the environment, so that could be, carcinogens like we mentioned. So like asbestos, benzene, some pesticides. So for example, Roundup is a really common one under fire these days because a lot of people who use Roundup on a daily basis, like in their farming or other jobs, have started having specific types of cancers, and so there are kind of big lawsuits associated with that. Tobacco, one of the most lethal carcinogens in the U.S., responsible for 30% of all cancer deaths, and then alcohol can lead to an increased risk of several different cancers. So things like throat, liver, rectal, colon cancer, breast cancer, etc. Radiation is a big cause of cancer, whether it's radiation like from radon gas, which just occurs naturally, or ultraviolet radiation, so like from the sun. So for example, skin cancer. The sun actually causes about 80% of all skin cancers. You also could get that UV radiation from specific lamps that give off UV radiation. And that type of UV radiation is just as dangerous and can cause skin cancer just as readily as UV radiation from the sunlight. And then your lifestyle choices, basically. So, like diet, obesity, lack of exercise, sedentary lifestyles, etc., can cause you to have a higher risk of cancer. So diet and obesity is linked to 30% of cancers. So eating a lot of red meats, saturated fats can lead to specific types of colon, rectum, or prostate cancers. High salt consumption, associated with stomach cancer. So basically, it's moderation is key in terms of reducing risk of cancer for say things like diet. So getting sunburned, not just painful, but over time it could eventually develop into pretty bad episodes of skin cancer where they might have to go in and actually cut out large portions or large areas of your skin to remove that skin cancer. Um, there are also cancers that are related to a fungal toxin that could be present in raw peanut butter. Diabetics have a higher risk of generating specific types of cancers. And then there are also some internal factors that we could have going on in our body. So, for example, metabolism produces free radicals which are particles that could bump into DNA and damage that DNA. But you could eat antioxidants, so things like which is found in blueberries, tomatoes, spinach, etc., which will neutralize the free radicals kind of bouncing around and help to prevent damage on your DNA. So here's a list of examples of carcinogens, so like tobacco, pesticides, alcohol, etc., where you could get those in terms of sources, what type of cancer it could lead to, and whether it's common, uncommon, or less common. You don't have to memorize this table. It's just something kind of for you to look at as a FYI. Now, in terms of preventing cancer, the immune system plays a really big role in that. The immune system, defends the body against cancer. The big problem is that cancer cells may not be recognized as self, and then the immune system can destroy them. But if so, the problem comes, so this isn't the problem, right? This is when the immune system is working. So if the cancer cells are recognized as self and are destroyed or are not, okay, let me back up. Cancer cells may not be recognized as self, meaning that those cells are not recognized by the body as being part of the body. And then the immune system will destroy those cells. There we go. That's the correct way to say it. And so the problem comes in is to where if you have kind of anything that suppresses your immune system, whatever may be the cause, if the immune system is suppressed, then it may not read those cancer cells as not being self, and they don't get rid of those cells. They don't suppress the cancer cells. And so they then become more susceptible to cancer because your immune system is suppressed. And so basically what happens is you have your normal cells through environmental factors, whatever that is, you get an abnormal cell. And then if your immune system can respond and detect that abnormal cell, then hopefully it will destroy that cell and prevent anything from happening. But if your immune system is suppressed, then you'll get your cell to continue to divide, and it could potentially develop into an in situ tumor or a malignant tumor that could potentially metastasize. Now, the key thing with cancers is trying to detect them early, and so knowing signs. But the problem there is that a lot of cancers don't have symptoms kind of early on. They could be really later in terms of what stage the cancer is before symptoms occur. So like some cancers may not show symptoms until they're stage 4. But there are some pretty good advances in diagnostic technology that can hopefully allow us to detect specific cancers early enough to help get rid of those cancers and treat them. Some of those diagnostics are things like imaging, so X-ray scans, CAT scans, ultrasounds, PET scans, MRIs. So a lot of these are there to really look at and try to detect any tumors that may exist. You could also do genetic testing to see if there are any mutated genes or if there are any genes that are potentially there that could lead to a higher risk. So like is there a gene that runs in your family that leads to a specific type of cancer occurring at a higher risk? So you can actually check for that. You can do enzyme tests to check for cancer markers, and so this is useful when you're screening large numbers of people. But most often you'll probably get like an imaging or have blood work done, look at like your blood cell count, that sort of thing. Now, here's some examples of imaging. So you have an X-ray, which is like you would get with a mammogram. You have a CAT scan showing a tumor in the lungs, an ultrasound scan. So this is showing a tumor on the prostate. Here's a PET scan showing a tumor in the brain. And here's an MRI showing a tumor in the brain as well. Now, whenever you are diagnosed with cancer, there are a couple of different treatment options that could exist. If the cancer is in situ or structured tightly together and has not started to spread, surgery is a really good option. But it also depends on where that cancer is at. So obviously, if it's in your brain, it's a little less difficult, or it's a little more difficult to potentially remove that tumor with surgery. Again, it just depends on where it's located. Now, radiation is a treatment where you basically target the tumor with radiation, direct radiation, that will damage the tumor cells and hopefully kill them. The downsides is that it's hard to pinpoint that radiation just on the tumor cells, and so you also will damage healthy cells in the process. Um, but what surgery and radiation could potentially do is miss small groups of cells that may have moved or metastasized to other areas of the body that you haven't potentially detected. So this is where chemotherapy kind of comes in, where you basically put drugs into the person, into their body, and it goes and destroys those cancer cells. Some side effects are that it will also kill normal cancer cells as well, but it makes that person really sick. So they could potentially get really nauseous, they could lose weight, they could become anemic. It makes it really hard to eat. Radiation does too as well, depending on where it's at. They lose their hair because of the chemotherapy. And so there are side effects to this, but a lot of the times those side effects are much better than what could happen if the cancer was not treated. Usually a combination of these treatments are used together. So for example, you could do like surgery and chemotherapy, or you could do radiation and chemotherapy in order to treat cancer, again, depending on the stage and the type of cancer that a person may have. Magnetism is another interesting way to treat cancer, and it's basically where they put a magnet on the tumor, and then there are tiny magnetic beads that are coated with chemotherapy drugs that are in the body that are then pulled to the tumor, and it helps apply the chemotherapy drugs to the tumor cells. Another treatment is photodynamic therapy, where they use light sensitive drugs, and so those drugs will be taken up by the cancer, and then lasers will be emitted onto the cancer cells, and it will activate the drugs. So that light from the laser will activate the drugs, and those drugs will kill the cancer cells. Another treatment option is immunotherapy. So this is basically trying to boost the immune response of the patient so that our body targets the cancer cells and gets rid of them. And so what they can do is they can tag antibodies with radioactive molecules, or they can use chemotherapeutic drugs to hopefully target and boost the patient's immune system. Another treatment is to starve cancers, and so you can do administer drugs that basically prevent the development of a blood supply to the tumor. If the tumor cells do not have blood supply, they don't get nutrients, they don't get oxygen, and so they're not able to grow and develop. And then the final one is molecular treatments. So basically you can target oncogenes, such as a mutated p53 suppressing gene, and try to target those genes and get rid of them so that they aren't allowing those cells to divide and replicate at an increased pace. All right, so the last thing we're going to do is just kind of run through the top 10 deadliest cancers that exist based off of number of deaths per year. So we have this list of cancers that we're going to go through. So lung cancer, colon cancer, breast cancer, pancreatic, prostate, leukemia, lymphoma, bladder cancer, esophageal cancer, and uterine cancer. So in that order is basically their ranking, right? So lung being the highest number of deaths per year, uterine cancer being the lower number of deaths per year. But what's also interesting is you have numbers of new cases and numbers of deaths, and you want to look at kind of the ratio, right? So for example, let's see, pancreas cancer has a really high death rate. So out of 48,000 new cases in a year, about 40,000 deaths. whereas something like prostate has about 220,000 new cases and about 27,000 deaths. So that death rate is fairly low, right? And so you can look at those numbers and actually tell what kind of the death rate is and the probability of somebody surviving that cancer, based off of those numbers. And so just kind of quickly going through these, the first is lung cancer, where smoking is one of the leading risk factors for lung cancer, right? So basically smoking increases your risk for lung cancer substantially. There's no real screening. It's often more advanced and at higher stages when it's detected, because early symptoms aren't really specific for suggesting that you have lung cancer. So things like coughing, having pneumonia and bronchitis, or having your voice change. So that could happen with other things as well. And so we don't really catch it early on because of that. Some later symptoms are like chest pain and blood in your septum, or not your septum, but basically your mucus. And so those are kind of like your alarming symptoms that you're typically going to notice and pay attention to. And again, so since those are later symptoms, it's probably already, stage 3 or stage 4, whenever you catch it, unless you're pretty adamant about getting it checked. Treatments, typically surgery combined with radiation or chemotherapy. And what you'll see for a lot of these is that that's often the case. 2 or more treatments at a time, like we mentioned earlier, trying to target these different types of cancers. So colon and rectal cancer is the second on the list. So we can use tests to get these pretty early. So symptoms would be like rectal bleeding, blood in the stool. Some risk factors for this is sedentary lifestyle, obesity, eating certain foods, so like a high-fat diet or a low-fat diet, family history, so maybe it's prevalent in your family. And generally, colon cancer starts out as a benign tumor, which will eventually become malignant. But there are colonoscopy exams that we can do, or that doctors can do, to examine the colon with a flexible scope to look for polyps and tumors, and hopefully catch them early enough to where they can remove those polyps and tumors before they become cancerous or metastasize. So here's an example of a colon scope where it's going up into the colon and it's examining a polyp that is on the fold of the intestine there, or the colon. The next is breast cancer. And so again, just kind of paying attention, checking yourself for any lumps really pays off, because early detection is really critical for survival. A mammogram is basically an x-ray that is used for early detection or detection of breast cancer. And so it's just looking for a lump in the breast tissue on those exams. Some increased risk factors are age, so higher in age, increased risk, obesity after menopause, early onset of menstruation or late menopause, which is generally associated with like some weirdness in your hormones, taking oral contraceptives, or using hormone replacement after menopause. And then also there are some genetics. So there are 2 genes specifically that if they're present, then that typically can lead to higher risk for breast cancer. Next is pancreatic cancer, rarely detected early enough, which is why we saw, the 48 versus 40,000 deaths. Second highest death rate of all of cancers, mainly because it's so difficult to detect. Because there's no early signs. Risk factors for these are smoking, and then the same 2 genes that are associated with breast cancer. Next is prostate cancer. Typically, this is more common after age 50, so your risk factors go up considerably after age 50, and so colon cancers is similar too. So after age 50 or so, you're probably getting routine exams, rectal exams, so you're examining for colon and prostate cancer. Some symptoms is, difficulty urinating, blood in the urine, or pain in the pelvic area, because the prostate is right kind of next to the bladder. And so if you have a tumor on the prostate, it's generally pressing against the bladder, causing these symptoms to happen. And like I mentioned, you can do a rectal exam, you can do a biopsy, you can do a blood test for a specific prostate specific antigen that can tell you if there's a tumor or not. And treatment for this would be a combination of things like surgery, hormones, and radiation therapy. Next is leukemia. Chemotherapy is often pretty effective for leukemia, and what leukemia is basically cancer of the white blood cells, so the immature white blood cells, and it occurs in the bone marrow. Having specific genetics can lead increased risk factors, so like Down syndrome, so it's trisomy 21, basically having 3 copies of the 21st chromosome, exposure to radiation, or infection with a specific virus. There are forms of leukemia that occur in adults as well as children. Symptoms are generally non-specific, but you can do blood tests to look at the blood cells and bone marrow biopsies to examine the bone marrow to see if leukemia is present. And you generally will treat with chemotherapy and bone marrow transplants to help fight that cancer. Lymphoma is cancer in the lymphoid tissues. So you have Hodgkin's and non-Hodgkin's lymphoma. So with this, you would have like intermittent fever, night sweats, weight loss. So it really kind of messes with your immune system. You get enlarged lymph nodes. You can have potential itching. Risk factors here are if you're exposed to like specific herbicides. I think Roundup is associated with lymphoma, but I'm not 100% sure. You might have to check on that. But HIV infection is increasing risk, and then also transplant recipients. So treatment would be radiation and chemotherapy for this type of cancer. Next is bladder cancer. If caught early, surgery is pretty successful with this type of cancer, and generally a symptom is blood in the urine. Again, because you've got a tissue that's kind of affecting you've got a tumor that's affecting the bladder tissue, and so that would lead to blood being produced in the urine. The way they would diagnose is to examine the urine for cancer cells. You could also do a cystoscopy, where you just go in with the scope and look at the bladder wall to look for any tumors. Risk factors are some environmental carcinogens, smoking, urban living, and being exposed to like leather, dye, or rubber, which again has carcinogens associated with kind of the production of those materials. And usually they would treat with surgery and chemotherapy just to make sure kind of everything, all the cells were removed and gotten hold of after surgery. Then we have esophageal cancer, so cancer in the esophagus. So this is a pretty high death rate, so basically 92%, 92 deaths for every 100 new cases. Risk factors are tobacco use, obesity, gastric reflux, so chronic gastric reflux. Usually we don't catch it at an early enough stage, which is why it has a very high death rate. By the time symptoms appear, generally 60% of the esophagus circumference is cancerous. And the way you would try kind of treat this is surgery, chemotherapy, and then a stent, and hope that you can get rid of all of the cancer cells through those processes. Then the last one is of the big 10 is cancer within the uterus. So one of the big symptoms is abnormal bleeding or spotting, and a big risk is kind of high exposures to estrogen throughout your life. So maybe you have like hormonal imbalances, and cervical cancer could be related with things like HPV. So ways you can check and make sure that you catch it early. If you do have it, it's just to get regular pap tests. And you could also get vaccines that can help prevent HPV, which could potentially lead to cervical cancer. And then pretty much all of the treatments that we've mentioned can be used for uterine cancer as well. Now, there are some other notable cancers that we're just going to kind of run through. So like kidney cancer, you would just kind of diagnose with imaging. You can surgically remove the affected kidney, and risk factors are pretty similar to a lot of others: genetics, smoking, carcinogens, increase with age, etc. Another big one is skin cancer. And there's three major types of skin cancer. You have basal cell carcinoma, squamous cell carcinoma, and then melanoma. Melanoma is the deadliest and least common of all of the skin cancers, and it's basically a cancer of the melanocytes. And the reason it's the deadliest is because it metastasizes very, very quickly. Basal cell carcinoma is in the basal base layer of the epithelium. So remember, we talked about that basal layer. It rarely metastasizes, but should be removed via surgery just to be safe. Same thing with squamous cell carcinoma, metastasizes slowly, most likely should be removed with surgery just to, be safe. And it involves the epithelial cells instead of the basal cells. Now, with looking at melanoma and trying to determine if you have it, you can do the ABCD method for examining and kind of keeping an eye on your skin and whether or not you have the potential for melanoma. So we can look at the moles and lesions that exist on our skin and look for a couple of key characteristics. So A stands for asymmetry, B stands for border, C stands for color, and D stands for diameter. So basically, if the lesion or the mole is not symmetrical, then it could be cancerous. If the border is irregular shaped, could be cancerous. If it's very dark or black in color, or if the coloration is varying, so like brown and dark, then it could be cancerous. And then if it's greater than 6 millimeters in circumference, so if the diameter is not circumference, but if the diameter is greater than 6 millimeters, so basically about the size of a pea, then there's a big chance that it could be cancerous. So here you have examples of these 4 characteristics. So asymmetry, so it's not symmetrical, it's not like a circle or a sphere or an oval shape. It has these, asymmetrical regions. The border is irregular, right? So you can see here this kind of irregular border. The color varies, so you see this dark area with kind of the normal brown, reddish area that you would expect from like a normal mole on our skin, or it could just be very large in diameter. But this one's large, and it also has kind of like varying coloration. So a lot of times you'll see kind of typical characteristics. So this one up here is dark, not symmetrical, irregular border, and it looks like it's pretty big in size. So that's like a big kind of sticking out, like, all right, we need to go get this tested. So you just want to keep an eye on these things, even though you might think you don't think you might have it. Just if you have moles on your body, just keep an eye on them. Check them on a regular basis, like whenever you get in a shower. Just give your body a once over, and that's with everything. You can check for lumps pretty much anywhere, and you can look at your moles, and you can just keep an eye and be knowledgeable about what can happen, which is why we're going through all of these different types of cancers and symptoms and what you could potentially look for. And so for males and females, you could have cancers of the reproductive system, so ovarian cancer and testicular cancer. Ovarian cancer, pretty difficult because there's no signs and symptoms generally, because usually symptoms associated with ovarian cancer are things that you would associate with other stuff, like abdominal bloating and swelling. You'd be like, well, maybe I have gas, or abdominal pain. Maybe I have an upset stomach, or maybe it is gas. Difficulty eating or urinary urgency. You could think of other things that could lead to that. But one of the big things for ovarian cancer is, again, early diagnosis. And that's with all cancers. If you can catch it early, before it invades other tissues, before it metastasizes, it's much, much easier to get rid of those cancerous cells than if they are spreading throughout the body. And then for males, testicular cancer, pretty uncommon, but it's easy to detect because you can give yourself regular examinations. And then you can go to physicals. So it's really easy for a male, whenever they're taking a shower, just to feel your testicles to see if there's any abnormal lumps or tumors. And, it may sound weird, or it may seem funny, I need to check my testicles every day, or, not every day, but once a month. Um, but you would be surprised at how that could potentially save your life if you're able to check it early, or to catch it early. And so just be knowledgeable. And the big thing is that most cancers can be prevented. And if they're not able to be prevented, then hopefully you can catch them early. And the big way of the big kind of factor in allowing you to catch them early is really to stay informed, to be knowledgeable about what cancers exist and what a lot of the symptoms are for specific type of cancers. Right? Know your family history, know your own body. Give those self-examinations. Go to regular checkups, your yearly checkups, or your yearly mammograms or colonoscopies after you turn 50, or all of those things, so you're being preemptive. So I don't want to tell you not to smoke, but just know that if you do, it increases risk. And so you want to pay more attention to signs that your body's showing. So maybe if you have a bad cough, don't associate it with, well, oh, I smoke. Maybe you should be like, okay, I smoke. Maybe I should go and just make sure it's nothing serious. And so that could help in the long run. And then moderation for everything. And so it's not just alcohol, but it's also what you eat, right? And how much of that you eat. And then just, trying to be healthy can reduce a lot of these risks for specific type of cancers. Okay. And so with that, that's the end of chapter 18. We have one more chapter to go through. That's chapter 19, which is genetics and inheritance. So that's going to take place over the last two modules of the course. Then you'll have your second exam practical, and then your final exam, and we'll be done for the term. And so, as always, email me with any questions, any concerns that you have. And I hope you have a good rest of your day, and we'll see you in our final chapter.